personally, what my recommendation is that if there is a delay at 2 years old, based upon what the parents have filled out on the screen and what I'm observing the child in the room, I typically do refer to speech therapy, because for any delay, there is better outcomes if you start the therapy sooner. I typically do refer at least at 2 years old if there's a delay, because the sooner they're in therapy, the better. And it really just depends on, how far behind they are. Is it a receptive delay? Is it an expressive delay? Meaning, are they not comprehending what they're hearing? Or is it just that they are understanding everything? It's just that the words aren't coming out. Another baseline thing to do is to check a hearing screen. That should be done for any child with a speech delay to make sure it's not a hearing issue. But if everything, if it's just an isolated expressive delay, if the hearing screen's normal, I get them to speech therapy and just see how they progress from there.
A lot of kids follow their own developmental path. And, my advice to that mother who seemed a little kind of disenchanted and disheartened after that visit would be, don't worry too much about it yet. There are tons of kids out there who have an isolated speech delay and are otherwise doing great. And it doesn't even mean much necessarily. And we really judge kind of on a case-by-case basis. If I've got a 2-year-old who is behind, but mom and dad say, hey, but he's making progress every day, we're adding new words every day, we really think that we're moving in the right direction and things are improving, well, then maybe we can hold off on that speech evaluation, just as an example. So, so I agree with Dr. Dureau. I think we just take every baby individually and see what they do and just make the best decision based off of what they're doing, and also based off of the parent's level of concern at that visit.